Well, it's 7 o'clock. Good evening. I'm Dennis Delwo. I'm a board member of the Healthcare for All Washington and also had experience as a state representative from the 3rd District here in Spokane. And as such, I was chairman of the Healthcare Committee, which kind of explains why I'm involved with the Healthcare for All Washington. A strong advocate, continuing even after my term as a state legislator for around 13 years. But we muted everyone except for me, thank goodness. And but you can add your comments at the chat on the Zoom. You're probably all familiar with that. And you can also find the link to donate at that site on our website. And we sure appreciate you donating for our work. Donations help us reach the point where we're able to get involved in the state legislature, and eventually we're going to be able to get healthcare for all, universal healthcare. We've been very successful this year. Our goal our goal for this presentation, for this program, is going to be $500. We try to have a goal set so that we will have something we can aim at. Any contribution would be appreciated. We look forward to anything you can contribute. One more note is that you can click on closed caption icon at the bottom of your Zoom screen to enable the caption to appear on your computer. Well, tonight we will have a report on the 2022 legislative session from Senator Reuven Carlyle. He's from I believe the 36th district, which when I was in, covered the Space Needle and Queen Anne Hill and beautiful area of Seattle. Later we'll have Senator Keiser, who is from the 33rd district, which is from the SeaTac area, I believe. And then Attorney General Bob Ferguson, looking forward to hearing him. We supported this session 22 bills, and those 22 bills were passed in the 2022 session. Our guide or lobbyist for those victories was Cindy Laws. Cindy has supported universal health care for the past 25 years and helped us build a relationship with the elected officials. Cindy will moderate our program tonight. Cindy?
Hi, everyone. Thank you for joining us today. And this has just been a phenomenal session. The relationships that we've built over the past several years really came to fruition. And I think that some of the keys to our success was in those relationships. A lot of times people want to, especially in the environment politically that we're in, where things seem so divided. And yet it's really important. One of the things that I keep focusing on is really important in building the relationships. And it has been astounding in the past 4 years how many more Republicans are voting our way, the way we want them to vote. And we'll talk later on about some of these particular votes, that the bills that passed sometimes near unanimously. A couple of them did pass unanimously on really important things like expanding primary care, and others we did have a big fight over. And that's where I want to start today. Really matters, leadership matters, and experience matters. Some of the folks that always want to talk about, let's throw the bums out, let's get term limits and everything else. And I think it's really important to highlight the value of experience and the respect that other legislators have for that level of experience. Reuven Carlyle has been in the legislature now for 12 years, 14 years, and he's a brilliant human being. I mean, that's just first off, you just got to call out the fact that Reuven is a very brilliant human being. He's worked in high tech. He's an innovator. He thinks outside. I hate the term outside the box. There's no box where Reuven is concerned. And more important is that Reuven is able to reach across the aisle and get respect and get the things to pass. But this year was really amazing. Reuven is not on our healthcare committees. He's important because he sits on other really key things. But what's always important is what happens in caucus, with stuff you don't see. It's the support behind the scenes. And that's where Reuven really excels. But he gave a floor speech. One of our very high priority bills was the Prescription Drug Affordability Board. And this is a really important bill that Senator Keiser We worked with Keiser to get this bill introduced and passed. And so we're going to start by showing you the floor speech when this bill came up for the hearing, it came up for a vote on the Senate floor. So I'm just going to sit back and let you watch this incredible, incredible speech.
Prescription drug prices are astronomical because it's the worst of capitalism and the worst of socialism wrapped together. It's absolutely impossible to make meaningful progress. Year after year, decade after decade, the people of this country are suffering from astronomical prescription drug prices. And the taxpayers footing most of the bill. We get enormous benefit from being the world's research and development hub. There's no question about that. It's impactful, it's valuable. Look at the incredible embrace of science with this rapid adoption of this vaccine. Just incredible, impressive to the researchers at Fred Hutch and around the world. And we're grateful to them, and we're here because of it. At the same time, dozens and dozens of high-cost drugs with margins in the thousands of percent are paid for by the taxpayers. The gracious senator from the 18th, who's so thoughtful about this issue, raised the issue of rebates. Guess what? There's one or two mid-level bureaucrats in a windowless office who are allowed to know the percentage of rebates. Is the good chair of the Ways and Means Committee allowed to know? No. Is the chair of the Healthcare Committee allowed to know the percentage of rebates in negotiations of drug pricing in the state of Washington? No. Illegal. Not allowed. Our good friends in the federal government have taken years to construct a framework that effectively does not allow the taxpayers of Washington to actively and aggressively negotiate the best price directly. Can't do it. Illegal. Don't want to break the law. Wouldn't be right. Year in and year out, the people of this state are suffering with astronomical prescription drug prices. We can take a responsible, a modest, a thoughtful, and a serious step forward with this bill. It's not perfect, and it's not everything, but it is an incremental step forward to open the transparency just enough to begin the process to identify the real issues on the table. We are more as a state and more as a country than what we've become when it comes to this issue. No one for a New York second isn't appreciating the research and development and the value of those investments from private and public dollars worldwide into original science. And the federal government's the original investor in so much of that. So why can't the taxpayer just get a little bit of kick on the end of savings for all of that original research money? Why can't we get just a slightly better deal? We can. And this bill is just a modest step in that direction. Let's think of the millions of people in this state who are so desperate for just a little bit of help to reduce their prescription drug prices. It has nothing to do with party, nothing to do with East and West, nothing to do with anything other than fiduciary responsibility to the taxpayers and to our own families. We're better than this. We can pass this bill. Thank you, Mr. President.
And with that, I was screaming and yelling, and I sent out a text to Senator Carlyle. I was just so enthused with that speech. So without further ado, let me introduce to you Senator Reuven Carlyle.
Thanks so much, Cindy. What a pleasure to be with everyone. Thank you all for your passion, your spirit, the work you do, your sense of conviction about the importance of healthcare. It's a real pleasure to be with you. I sit right in front of Senator Keiser, so of course I get to hear the double secret probation, CIA secret talks about what's going on in our negotiations on all of these bills. And I just really appreciate the role that everyone plays. I know that, on some level, we live in a time when we focus on access, we focus on affordability, we focus on quality. But, truthfully, there's also a time to celebrate, because the focus on those areas has led us to this very moment where, as Cindy said, we're at a time of celebration. We've had an unbelievable couple of years. It's extraordinary. We've made progress on access, progress on affordability, and quality. And we've made progress on dental. We've made incredible progress on behavioral health. And I think there's a lot of grace and intentionality and a lot of humility in all of us having a sense of gratitude, of acknowledging the magnitude of that work. Prescription drugs are sort of a symbolic representation of the challenge, of how hard it is to move some of the policies forward. But I think we should really acknowledge the magnitude of the accomplishment this year. And the activism and the spirit and the phone calls and the combination of understanding the inside game and the outside game, that's what's brought us to this moment. And, over the last number of years, it just feels like we've really elevated our game at a political level, at a strategy level, at a substance and a policy level. I know a little later on tonight, the Attorney General will speak about the bill that he really got behind and put a lot of juice behind. It's incredibly important to recognize that every level of government matters and every level of citizen activism and engagement matters. I think, the Charity Care Act issue around access is incredibly important in a time of consolidation of these healthcare systems. And that's a really constructive piece of it. The primary care issue is just absolutely core, and acknowledging at the same time that that sort of the ecosystem of care, the continuum of care, really requires a lot of support. And so I feel really great about the accomplishment, about where we've stood. It's been a great honor to be everyone's partner in service in the legislature on a lot of these issues. I've enjoyed being behind the scenes on many of these issues. And of course, we tackle them on the Ways and Means Committee. I would say that I think the last number of years, the last 3, 4, 5 years of success here really point to the importance of understanding the substance of the moral authority thought leadership that we play as a state. When you go to the National Conference of State Legislators and other national conferences, people gravitate toward Washington State. They understand that we're thought leaders. They understand what Senator Frocht has done in his work, Senator Cleveland, Representative Cody, and I just don't think we should underestimate the impact of that kind of work. And the partnership with the inside folks and the partnership with all of you has just been incredibly impactful. And I know that we live in a time when we're frustrated at Congress's inability to act, but state action is meaningful, it's substantive, and it's been incredibly powerful for all of us to make this kind of accomplishment. And the last thing I just really want to say is that climate action is public health. Climate action is deeply, inextricably tied to this work. And it's been my great honor to be lead on that issue in the Senate and a partner with the governor and so many others. And I just really appreciate the voice that everyone who's passionate about healthcare has brought to that work. And that has made a difference. And we're really the leading state in the nation in our climate work. We're the leading state in the nation in our healthcare work. And when you put that together, it shows the people of this country that we can be in a different way, that it's not all defensive and it's not all just taking one step at a time. We're taking really big and bold and courageous steps. And I think, you deserve a lot of credit for that. So it's really a great pleasure. I will say that I had, it's funny that Cindy played that speech, because I got a ton of emails from just regular constituents saying, "Hey, far out, I saw that." So I had to laugh a little bit because not too many people normally watch TVW, but that was one that elicited a little bit of fun. So with that, thank you, Cindy, for all your incredible partnership in this work.
Thank you. Well, I was trying to get that video. I sent the video off to Rachel Maddow. I sent it to Bill Maher. I was trying to get this thing picked up and go broader. That's how proud I was of your speech on that, and not just the speech, it's the work behind the scenes. And that's what I hope that everybody who's with us today, I hope that everybody's with us realizes the amount of work that goes into this and how dedicated the legislators like Senator Carlyle are. And Senator Carlyle, I am just, again, I'm bereft that you will not be with us in the next session. The shoes are impossible to fill. You and I have both been around this stuff a lot of decades, and it's just, I can't imagine how these shoes are going to be filled. But I hope that you'll continue to be vigorously involved and continue to make super, super big changes.
I appreciate that. I appreciate that. I'm not planning on being dead, and I just appreciate everyone's work and passion and support. And congratulations, everyone, for a very successful couple of years.
Thank you. Well, and then you've got the 2 kids. You've groomed those kids, and they're going to be filling another huge role. And with that, I'll shift over to our Attorney General, Bob Ferguson, who just was left with his daughter at her baseball pitching practice. So it's really great to not just have really incredible leaders, but those who are so involved. Their families are such a huge part of why they do what they do. I got to tell you a little story, Bob. A lot of people do not know. Our Attorney General, I first met him when he was the executive director of the King County Democrats. I was working for U.S. Senator Brock Adams at the time, and he was the executive director, and thought, man, this kid is amazing. So that was a long time ago, long decades ago, and I've supported him in every single election he's been in. He's taken people down, and he continues to take people down. And while he's also building things up. The most important thing this year, we were so thrilled. I was just over the moon when I received an email. We had testified in favor of the Charity Care Act, which was requested by the Attorney General. And so we testified strongly in favor of this bill. And when the bill was appearing to be stalled, then the Attorney General's staff reached out to me to help get it moving forward. And I was thrilled. And going back and forth with the people in the Rules Committee, of which Karen Keiser is the second, after the Lieutenant Governor, Keiser's the vice chair. So really getting an inside scoop on what was going on. We got this bill done. So for people don't realize how the impact the Attorney General has on healthcare, I give you the Attorney General, Bob Ferguson.
Oh, so Cindy, thanks so much. And it's great to see you all. First, everybody could give a round of applause and a thumbs up for Reuven Carlyle and his great service. He, of course, in the 36th, which is where I was born and raised. So I feel an affinity to the 36th district. But Reuven, thanks for your service. We're gonna miss you, obviously, in the legislature. But we know you're not going too far away, and we know you'll be active. But great to see you, and thanks for being on tonight and all your leadership on these issues. And yes, Cindy, my God, we won't even say what year we first met. So it's but it was a long time ago. And but it's great to see you again, and all of you. Thanks so much for your work on these issues in our state. I was cutting a little close to getting on because my daughter she's a fast pitch softball pitcher on her team. And so Cindy, today I'll tell you that I was cutting a little close because she was with their pitching coach, and I'm the catcher, which is a little dangerous. I'm the catcher. She's throwing faster all the time. She's pretty good. She's an 8th grader. So we have a deal whenever she gets a new record for how fast her fastball is. When she reaches another mile per hour faster, we have to stop at Dick's for milkshakes and fries. And so she happened to do it. She did it tonight. So man, I'm cutting a little close, but fortunately the Dick's line was fast, and I was able to get that done and throw on a shirt and get down here to see all of you and to talk about really this great bill and the great teamwork that was involved in getting it passed. So maybe what I'll start with is something that all of you know, right? Which is that medical debt is such a leading driver of folks facing homelessness and other economic challenges. And too many Americans and Washingtonians are living paycheck to paycheck. And one unanticipated bill, out-of-pocket expenses, even if you're insured or if you're uninsured, other medical debt, causes huge harm for individuals and their families. And a bill that I'm going to talk about for a few minutes tonight is a bill that will significantly increase a program that currently exists in Washington. So in Washington State, we have what's called charity care. It's a bit of a misnomer. I'm not sure I really like the language too much, but essentially what it is it's a law that says if you are of a certain income, low income status, you are eligible for either a full write-off of any medical debt you have or a partial write-off of your medical debt. So basically for a 2-person household, if you're making, under existing law, before we propose a change, you had to be having an income of under $18,000 to qualify a write-off. Pretty stringent. to be clear. Stated another way in Washington state, if you were a single parent and you worked 2 minimum wage jobs and you worked 50 hours a week, you were not eligible for a write-off of those medical expenses. That's a pretty narrow program for people in our state, as you might imagine. And so the bill that we proposed, which thanks in large part to your help and many others, we passed on our first try, which I never would have thought, Cindy, as you know, getting a bill this big, this complex in the first session, honestly, I would have given us about a 2% chance, but it's going to have a huge change. It significantly increases eligibility for those full write-offs for out-of-pocket hospital costs, as well as expanding eligibility for discounts. And it's literally for a couple million Washingtonians. This radically, dramatically changes and expands our program. You may be wondering, hey, what's the Attorney General doing proposing legislation? What's he doing on healthcare issues? And just in brief, as Attorney General, I can propose bills to the state legislature, just like the governor can, for example. So we literally draft them up, and the team works with legislators. It's got to go through the normal legislative process, of course, pass the House, pass the Senate, be signed by the governor, but legislators know it's coming from me and my office. And so we often do this in areas where the AG is involved in consumer protection, civil rights, criminal justice reform. You get the idea. Healthcare may not seem intuitive to why the AG's office is involved, but actually we're pretty deeply involved. So as an example, in the last 5 years or so, the team in my office has been working on making sure that hospitals follow the law that I talked about that says certain individuals, if they are at a certain income level, are eligible for write-offs or discounts of their medical bills. Well, these hospitals have very specific criteria to inform people that they have this ability, that they have this right. Because let's face it, how many Washingtonians even know they have this? Very, very few, right? So there's an obligation on hospitals to inform people, right, before they start collecting on bills that people may not have to pay. Well, unfortunately, too many hospitals don't follow those rules. And so we have filed lawsuits against large hospitals. We had one example against CHI Franciscan and St. Joseph's in Tacoma, filed lawsuit that they literally trained their staff to ask for payments every time without exception. And in the end, CHI Franciscan had to either pay back to individuals who paid for medical bills that they should not have, or provide write-offs of debt of totaling over $40 million for thousands of Washingtonians who'd use those hospitals. I mean, it's kind of crazy when you think about it. $40 million in medical debt or money paid had to be returned or written off. And that's just one hospital system in one case. And we've had others. So in doing that work, that enforcement of that charity care law and doing that enforcement work, I just got interested in this and these laws and what they say and what they do, and realized that compared to Oregon, for example, far fewer Washingtonians qualify for this benefit than individuals in Oregon. Well, what sense does that make? What's also unfair is certain hospitals do provide greater charity care, others do the minimum. So depending on basically which county you happen to be in, what city you happen to be in, what hospital you happen to go if you have an emergency, can be totally dependent on how much of a write-off you get if you are in that low income status. So we did some research, looked around the country, and found that Oregon had a far better system than we did and provided assistance to far more Oregonians than we have here in Washington state. So I'll try not to get too much in the weeds, Cindy, but just to give you a sense of it, there now are literally 1 million more Washingtonians will be eligible for these full write-offs. And another 1 million Washingtonians will be eligible for partial discounts, again, based on where you are relative to the federal poverty level. So I won't go too much into the details on that, but it's transformative. The other thing I'll say is that, to their credit, the hospitals largely supported this bill, and that's to their credit. And so it really took a team effort, but that's thanks to grassroots organizations and people out there who supported it. Also, I think they sense we worked this bill pretty well. We had our ducks in a row. We had a lot of early support. And so, but their support was critical. One thing we did was we give small independent hospitals and rural hospitals a bit of a break. Now, most of the work, of course, is done at sort of large urban hospitals, but there is a bit of a break for those smaller rural ones. So just to give you an idea, an example of how this works. So a senior on a fixed income of more than $27,000 per year is not eligible for financial assistance under current law. Okay. So even those on Medicare, there can be significant out-of-pocket costs associated with hospital care, as you all know. Thanks to this bill, seniors with fixed incomes up to $40,770 will pay nothing out of pocket as a result of the change in this bill. A family of three making more than about $46,000 a year, not eligible under the current law, but because of the changes as a result of this bill, they are now entitled to free care up to $69,000. So huge changes that I think you will all see is not just good for Washington State, but I think you'll see other states following our lead, which is always a good feeling, right? Just like we saw what Oregon was doing, said, wait a second, how come we're so far behind Oregon? I think you'll see that with others as well. One more thing maybe I'll mention, Cindy, before wrapping up is that, we look closely at the Oregon experience. One thing we benefited from was Oregon passed their changes, I think it was maybe 3 years ago, I might be off, but it'd been a long enough period of time that we could sort of see, hey, well, did this drive up costs for hospitals? Did any hospitals have to close down because of this? What were the implications of that policy change in Oregon in terms of the hospitals or just healthcare for Oregonians? So we reached out to the Oregon Health Authority, and they reported they'd not seen any evidence that their charity care requirements are causing hospitals financial difficulties. So that is, a huge change that will be a tremendous benefit. And again, just I wrap up, it's, anytime getting a bill passed, Cindy, as you know, and I suspect everybody on this Zoom knows, it takes a village, right? I mean, you can have the best idea in the world, but if you don't have folks who are at the grassroots level pushing these things, folks you can call like Cindy in this org and say, hey, we need some help here. It was getting towards the end. It was close, we just needed some extra push. I want to say that, one thing I'm really convinced of is if you want to get a bill passed, you've got to have not just a sponsor in the legislature, right? Not just someone who says they support and put their names on it, but you need someone who'll be a champion for it. Like someone who really will just say, you know what, this is my priority. I'm gonna do whatever it takes to get this bill across the finish line. And State Representative Tara Simmons was certainly that person for us on this bill. She comes at this from some personal experience of her son having challenges in accessing the benefits. And from her own experience with her son, she also realized we need to make some changes. So we joined forces, and she was really a powerful voice on this as well as we move this forward. And maybe the last thing I'll say before I join my kids for dinner upstairs is that feel free to reach out to my office if there are things we can do to be helpful down the road on issues that we all care about. So I know people think of the AG's office as exclusively a law firm, and we are, of course, the largest law firm in the state. We're a pretty big operation, but we do have a policy team. We do propose legislation, anywhere from 6 to 12 bills a year. I don't know how many bills that we've proposed that passed since I've been Attorney General the last 9 or 10 years, but I wouldn't be surprised if it's 50. It's a lot of bills that we propose that get passed and signed into law. And lastly, I should say, this bill did have bipartisan support. There wasn't a ton of Republican support, but there was Republican support. Yep, there was Republican support. We worked hard for that. Virtually every bill I've had passed has had bipartisan support. And it's important to reach out to both sides of the aisle on these bills. And the fact that we got done the first year, my goodness, it was just such a huge bill, and it'll be transformative for so many Washingtonians. I'm just super excited about it, and just really appreciate all your work on all these issues that impact Washingtonians. It's great to see you all. Cindy, thanks so much.
I have one question.
Meeting. Yeah.
One question for you. What gives you hope that we can move to universal health care in the state of Washington?
What? Sorry,
what gives you hope that we can move to universal health care? We've passed Healthcare for Washington to help develop the pathway to universal health care bill 4 years ago. And then we helped pass the Universal Healthcare Commission that was created after last session. It's now, the meeting is tomorrow. So it's actually working. But do you have hope that we can actually enact this in the state of Washington?
Yeah, I guess what I would say, just sort of speaking generally on making changes to providing healthcare for all Washingtonians and improving that access, I guess what I would say is that it's my sense, Cindy, and look, I'm not in the legislature, right? Someone like Reuven could answer this question better than me. Let me start with that, right? While we work with the legislature, I am not a legislator, right? And so while we engage on these things, that's a different experience than being in the middle of it, right? Obviously, but What I would say is, well, just the fact that this charity care bill passed on the first try. It's my sense on having engaged in this issue in a deeper way this year than the past, because we had this big bill we were pushing and having conversations with. I think shows what's possible, right? That literally, I thought, hey, this is a 3 to 5 year project. Okay, that's what I thought this bill was, a 3 to 5 year project. And it's just my sense in the conversations I had with legislators is I think they're recognizing that this is a case where the people are way ahead of the politicians. You see that in issues sometimes where the people just are ready for changes in a way that it just takes the politicians longer to get there or to realize that's where the people are. And I think that these issues around access to healthcare, I think, fall in that category. So it gives me some hope that, hey, this year, this bill passed, right, on a first shot. But look, on all these issues, it's going to take all this work together. Reuven's right. You need elected officials at all levels of government, but you need grassroots support to make those phone calls, to write those emails, to show up and testify. And take my word for it, it matters. It really does. And just really appreciate everybody being so engaged on these really important issues.
Great. Well, thank you so very much for all of your work and your leadership. It's just been tremendous. You've got a phenomenal staff. Love your staff.
They are fantastic. One of them's on. Dan Jackson's on right now. So the team, I mean, look, I like to say, people sometimes say, Cindy, oh, Bob, you got such a hard job. And honestly, I feel like I got like the easiest job in the office, right? Because the team, they do all the hard work, right? It's in fact, the team came to me with this idea. It wasn't like I dreamed it up one day, right? It wasn't like I dreamed it up. My team came and said, hey, just so you know, here's what's going on, right? And I said, well, let's go out there and do some research. And so I've got the easiest part of the equation, but they're very good at what they do. And so I appreciate you mentioning that.
Great. Thank you. Thank you very much. Thanks for joining us.
You bet. Have a great night, everybody. Great to see you all.
Thank you. So we mentioned that Senator Karen Keiser has been mentioned several times here, and Karen I cannot possibly overstate the importance of Karen Keiser. Senator Keiser used to be she was longtime chair of the Healthcare Committee in the Senate, and then but she's also, we call it the trifecta. She sits on that committee. She sits on Ways and Means, and then she sits on Rules Committee. And on Rules Committee is where the bills oftentimes die. You've passed it out of the Policy Committee, which in our case is the Healthcare Committee, and then you've passed it out of the Fiscal Committee, which is Ways and Means Committee or Appropriations in the House. And then it goes to Rules Committee, and that's kind of where they determine how many bills will they actually think that they can get done. And they often go to die in Rules. Having Keiser as the vice chair of Rules in the Senate, the lieutenant governor's chair, the president of the Rules Committee, but Keiser is the vice chair. She's also the person who takes the gavel on the floor of the Senate when the lieutenant governor isn't there. So having a friend in Senator Keiser, we just cannot overstate the importance of the relationship that we have there and how great a relationship that it is. Keiser's one of those that we reach out to early. We have reached out to her, right after session, say, let's start talking now about what needs to be done next year. And that's really important because on certain things, like 2 years ago when we had passed groundbreaking legislation on insulin, we passed bills that had controlled the cost, capped the cost of insulin at $100 for a 1 month supply. That was a really big deal. And we also had a board, an insulin affordability board, where we wanted to have the state consider bulk purchasing of insulin in the same manner that the childhood vaccination program purchases vaccines and distributes them, so the vaccines are free for children. And it was Keiser that helped develop that childhood vaccination program. So we used that earlier legislation she'd created some 20 years ago to use the model for how to do insulin. Well, we had to redo the insulin bills because of the COVID thing, nothing happened. Even though the bill had passed and it was in law, nothing happened because everything else, kind of went to a grinding halt. So Keiser came back and we got those insulin bills restarted. We had to redo them again this year with new dates, but we also dropped the price from $100 a month down to $35 a month for the copay on that insulin. We put some things in place to improve. One of our big missions at Healthcare for Washington was to any board commission, work group, study group, whatever. Our mission, my mission has been to make sure that we have real people on those. In the past, most of these boards and commissions were pretty isolating. They would have members of various departments on there, but they wouldn't have real people on there. They wouldn't have the people that were affected by a specific illness, in this case, diabetes. They wouldn't have regular human beings on there. And I kept comparing it to things like there's an anadromous fish commission, for trout and salmon, and that has real people on it, actual general members of the public. So I've used that as an example. So we were able to get 4 members, people who are affected directly with insulin, either parents of young children or people themselves. And then one of our former board members is going to be appointed to that committee, that commission, the insulin commission. So these are some of the great work that we did in working with Keiser to get these done. So we're going to be playing next for you. It's one of the, we talked earlier about the Prescription Drug Affordability Board. And this, again, this is another board where they're going to be examining, the purpose of this legislation was to examine the cost of some of the most expensive drugs that are sold in the state of Washington, examine the costs of them, why they might be so high, and look at price controls on these drugs. This was a highly charged issue. This was not particularly bipartisan. I think we got one Republican vote here and there, but it was very hard fought legislation. So if you've got queued up, we're going to play a floor speech from Senator Karen Keiser when this bill was going for final passage.
Thank you, Mr. President. I urge the body's support for establishing an oversight affordability board on prescription drug costs. We actually passed a similar bill a couple of years ago, but then the pandemic hit and all the bills that got to the governor's desk, including this one, got vetoed. So we improved the bill a bit and came back with this bill before us tonight. We know prescription drug prices are increasing and that in many cases they are too high. I often point to the real problem that people who have multiple sclerosis in our state face when they have $100,000 plus prescription drug bills every year just to live. And we know that other very necessary and not even new bills have those kinds of increasing costs for people. And when the costs increase, we know that health decreases because people skip doses or they cut pills in half and they do whatever they can to make it all work out, but it doesn't work out. Their health is damaged. Other states have already adopted a prescription drug affordability board because unfortunately our federal government hasn't been able to take significant action on prescription drugs yet. So many states are moving in this direction. We started down this path a couple years ago, and as Senator Mazzal has done so well, by hounding the HCA to get their drug price transparency report out. And if I may, read from this new drug transparency report program that just came out. Thank you. We wanted this about a year ago, but it came out just in the last few days. And in the report, we find that, if I may read.
Please proceed.
73 of the new drugs that had prices exceeding $10,000 a month at the time of market entry. 86 drugs met the definition of covered drugs, had 20% price increases in a 1-year period. 34 of the drugs had a 50% price increase within a 3-year period. 97 drugs met both the criteria of a 20% increase over 1 year and 50% over 3 years. You see what the problem is. I do think this is a common sense approach by appointing a board of experts to review the affordability of prescription drugs and being able to set an upper price limit on those drugs, at least up to 12 drugs a year. We can put pressure downward on the price of drugs, and that's what we need to do. I urge your support.
And so we're going to move in now. Senator Keiser couldn't be with us in person, but she did create a video specifically for this particular speaker series event. And so we'll be playing that now for you.
I'm Senator Karen Keiser from the 33rd Legislative District in South King County. As most of you know, I'm also chair of the Labor, Commerce, and Tribal Affairs Committee, a longtime member of the Healthcare Committee, and Senate President Pro Tem. I really want to thank you for the work you've been doing over the many years that you've been active, and in particular this last session, which was so vital and so productive. Your efforts year in and year out are what make it possible for the legislature to take action on the important issues that we had up on the deck this year, including the issue of the cost of prescription drugs, which is something I've been focused on for some time. It was a short, intense session, 60 days. And as your conference says, 22 in 22, you were successful in many different arenas this year. Congratulations. I also wanted to talk a little bit about where we still have to go, because we aren't finished yet. Now, we did make some significant progress over the last couple of years, and I just wanted to mention we did start with getting an all-payer claims database enacted in 2014, and then opening up the transparency of drug prices in a bill that we passed a couple of years ago. Those two pieces were absolutely vital in order to get the prescription drug affordability passed and enacted and implemented. So those pieces were foundational, and they gave us the tools we needed. And one of the issues that I have been particularly incensed about, and so have so many other people, is the price of insulin. You know, over the past 15 years, the cost of insulin has gone up about 3 times, and this is a 100-year-old drug. This is ridiculous. And so one of the bills we did pass this year built on a bill that I had passed a couple of years ago on the out-of-pocket cost cap. We had originally had $100 a month out-of-pocket cost cap. We reduced that this year down to $35 a month for insulin. Insulin is a life or death drug. We cannot allow this drug to be out of the price range of the diabetic patients and people who need to have insulin to live. We heard from so many patients who were cutting doses and skipping doses and really harming their health because they weren't getting the right dosage for treatment of their diabetes. So we did get those bills passed, and that's one of the pieces of the whole piece of prescription drugs. We also expanded and reenacted the total cost of insulin work group, and we also have the underway the implementation of a program to purchase and distribute insulin or enter into partnerships with other states to produce, distribute, or purchase generic prescription drugs. Now, these are not fully implemented yet, but they're very important first steps. So this year, as you know, my top priority was getting Senate Bill 5532 to the governor's desk, and we got it done with your help to establish a prescription drug affordability board. That sounds very bureaucratic, but what this board will be is a board of experts appointed by the governor that will do affordability reviews on up to 24 drugs a year, and they will determine what the affordable cost and appropriate cost is for the drugs. These are drugs that have had high price increases and that have been on the market for years. So these are drugs that really do deserve significant scrutiny. And what this bill will be able to do, and what this board will be able to do, is set an upper payment limit for up to 12 drugs a year, and just establish that as the cost and the price that we will pay for those drugs. And by we, I mean all our public programs as well as our private insurance plans. So this is really a major step forward in terms of containing the cost increases and to put leverage downward on the price of prescription prescription drugs. So this is not going to happen overnight. It's going to take time, but we're going to get this done. And the infrastructure is in place now with the passage and the governor's signature of the Prescription Drug Affordability Board bill. And thank you again for your advocacy and help with getting that bill all the way through the process. So those bills are big steps forward, as I said, but we have a lot of work to do to ensure we provide health care for all. We haven't got there yet, and we're continuing to work on that. But I do want to mention a few other bills that we did get through this year that were really important. One is a couple from Representative Cody to make sure that hospitals provide better charity care services to patients who can qualify for those kinds of charity care coverages in hospital services. And the other one is to ensure that people do not get hit with surprise billing if they go to the emergency room and have a doc in the emergency room who's out of network. So those bills really will help. And then, of course, the other bill that's really important is that we expanded the number of providers who can provide abortion services in Washington state. Given what's happening at the Supreme Court, we know we're going to have a lot more patients visiting us from other states who need care. And by allowing other providers to provide that care for their reproductive health, we will be able to do a real service for everyone. So we still have work to do ahead of us. And I want to mention that I'm going to be working on a bill with Representative Tai that we almost got passed this year, but not quite. And that is to make sure that our prescription drug labels on the prescriptions we receive as patients are in a language that we can read and understand. We have lots of patients who do not read English, but they get a label that's in English, and we need to change that. And the bill would have done that. It got through the House and died in the Senate, and it was infuriating to me because it's such a common sense bill. And we need to work with our state's pharmacy board because they were very resistant, and we need to work with them and bring them along because their resistance, I'm sorry to say, stopped that bill from passing into law this year. So we have something to do next year as well. And I'm sure in your conference and in your work in the next few months, you'll have some other ideas of things we need to do as well. So once again, let me just say, thank you so much for the invitation. I wish I could be there in person, but as you know, I had a conflict. So let's stay engaged on these issues. We've got work ahead of us. Celebrate today and look forward to tomorrow. Thank you so much.
And we're so grateful to Senator Keiser for this continuing ongoing partnership. As we move forward for the next year, there's still another moment to touch on some of the things that we looked at. And I want to point out, so we were introduced at the beginning of this by Denny Delwo. Denny Delwo is to have Denny Delwo on our board. I can't tell you how great it was to have him join our board of directors. Denny was the author, one of the authors of the Basic Health Plan that Washington passed back in 1988. Just think about that, 1988. We actually did enact a universal health care bill in the state of Washington. And what's always troubling is we can do it, but we always have to fight to keep it. And so now it's a matter of taking what, we had to remind people when we were passing the Pathway to Universal Healthcare bill. I kept citing the things that had happened there. I read off the list of the board members or committee members, healthcare committee members that had served on the healthcare committees back in 1988, and over half of them had passed on. And so it was one of those where we have to keep reminding people of what we have done. This is possible to do. We have to keep fighting. We have to keep doing things that educate people, because as one of the things we've learned is that amount of disinformation is bigger than the amount of good information. And so we have to constantly work hard. We've been completely shut down as far as being able to do, really good grassroots stuff the last couple of years when you can't meet people face to face. And we're doing everything this way. But because of the strength of the members of Healthcare for Washington, we've been able to keep moving forward. We've expanded our board, we've expanded our committees, And I'm just so proud of this organization. And as mentioned earlier, I was associated with this organization back in the 1988 with Healthcare 2000, which was what it was called back then. We were trying to pass an initiative. So we've gone through a lot. But that basic health plan was kind of gutted when the other party took control of the legislature after the 1994 slaughter. And then during the Great Recession of 2008, 2009, 2010, where the revenue was still shortfall, the program was completely unfunded. Technically, it's still on the books. It's never been repealed. It's just not funded. So there's a lot of things that can be done, and I hope that you'll all continue to fight hard for these things. We always looked at, when we determined what bills to support, the difference between Healthcare for All Washington and other organizations is we're fighting for care, health care, not just coverage. We want people to get health care. We want to look at whether the bills would expand care, whether it would control costs, whether it would increase transparency, and put in accountability measures. And those were the things we looked at. So a lot of the bills that we supported, that we passed this year, are things that people may not completely understand how they are the building blocks, but they're absolutely important to ensuring the transparency and accountability. That helps get past some of the disinformation that's out there. When we can have it very clear, people can see very clearly the price gouging and those kind of things. So again, it's just really tremendous. Some things that I want to emphasize that other things that people have talked about is climate change is a healthcare issue. This needs to continue to be hammered forward. Homelessness is a healthcare issue because of mental health, because of treatment, and because of medical debt. So many things come back to healthcare. If people are taken care of, if they're healthy, they're more productive, their mental health is better, and so on and so forth. And we have a much better population. And so it makes for a better world. So Healthcare for Washington, all of you members, board members, and committee members have been doing just phenomenal work. I encourage everybody to continue to keep fighting the good fight. It's been wonderful. And so I'm gonna hand it over to Denny. Hand it off to Denny.
Thank you very much, Cindy. We have just a few minutes left, and it's a perfect time for everyone to get in the chat room, and you can make contributions there. I think you've seen how effective we've been, especially with Cindy. You'd had the Attorney General, you had 2 senators that just spoke highly of what we did, but that's what Cindy did. And that your help is desperately needed so that we can continue to do what we've been doing so well. Cindy has been just a real blessing for our group. As a state legislator, I appreciate it more than I think most people do, what a good lobbyist can do for an effort such as ours, because she was able to get access to the people that you just saw talk, and many, many more, to be able to get their votes, answer their questions, and make sure that the votes are timely, the bills come out on the floor and are passed. We can't do that. We need to have someone like Christy to be able to be the person that is going to put the work that we do on the floor of the House of Representatives and the Senate. We just can't do that without someone such as Cindy. And I want to thank you, Cindy, for the wonderful work you've done. We saw tonight from Senator Keiser and Senator Carlyle, as well as the Attorney General, that they all look to you as the person that has helped get their bills through, our bills through, all of which are connected. So thank you very much for doing that. And what makes this possible is the contributions we get from the people from the state of Washington. And so I want to encourage everyone to try to contribute, small or large. We really appreciate it, because that will make a difference. But I don't know if there's anything more that we need to cover. We've got another.
Denny,
Yeah.
I'd like to say a few words.
Certainly.
Yeah, I'm Peter Lucas. I'm a board member of Healthcare for All and a practicing physician. And I'm also chief fundraiser for the organization. And as you just heard, there were many healthcare successes in the past few legislative sessions, 22 in 2022. And the speakers tonight, Senators Carlyle and Keiser and AG Ferguson, discussed some of these. and highlighted the very effective advocacy of our organization to bring them to fruition. In addition to those, it really wasn't mentioned that much tonight, but we were the driving force behind the Universal Healthcare work group and had 7 members in that group. Their work led to the creation of the Universal Healthcare Commission, also with many members we advocated for, that is tasked with creating a system to provide healthcare to all Washington residents. They could craft a single payer system based on our bill, the Washington Health Security Trust. Now, in order to maintain our momentum, it is vitally important that we grow our membership, educate the public, and mobilize our supporters to spread the word to their family, friends, and most importantly, their legislators. And we can achieve those goals through social media, monthly webinars, meetings with civic groups, and by hosting other events. Our legislative efforts require a lobbyist, and Cindy Laws has been very effective in that role for several years. And you've seen her tonight. She's phenomenal, and she's just done wonderful work. Also, we have a communications specialist on staff, and we have some other fixed costs. These activities and obligations all require funds, which is why we are asking you to donate tonight and during the Give Big campaign this spring, which starts in a week or two, but about a week, and goes through the beginning of May. And you'll be hearing more about that campaign in the days to come. And our goal tonight is $500. Please go to our website or into the chat, click on the donate button. You can make a one-time donation, but we would especially appreciate it if you could make a monthly recurring donation. As I like to say, it's like a Netflix subscription, except you might get universal health care instead of movies. So please donate so we can spread the word and bring about universal single-payer health care in Washington. Thank you.
Thank you, Peter. Unless there's anything else, we can wrap this up. Thank you very much for coming, and we appreciate your support. And it's been a very interesting evening.